I have another question for you now. What are the most common complaints of patients who come to the psychiatry outpatient clinic?
Of course, this varies depending on the structure of each psychiatry outpatient clinic. But here, we don't have a private clinic or an inpatient ward. Mostly, patients come in with depression, anxiety disorders, and problems in interpersonal relationships. But if you ask which diagnosis you make most often, what is the most common diagnosis you encounter and make? In general, I can say anxiety disorders.
I know, but what are anxiety disorders?
Anxiety disorders are actually an umbrella diagnosis. Under this umbrella are many anxiety-related disorders, such as generalized anxiety disorder, panic attacks, specific phobias, social phobia, and obsessive-compulsive disorder. Among these, we most frequently see generalized anxiety and panic attacks in the clinic, as these most affect daily functionality, severely disrupting life and creating an urgent need to see a doctor.
Anxiety is an emotion we all experience daily. So, what intervention is needed for someone with an anxiety disorder?
Anxiety is truly an emotion that all of us experience throughout the day. Anxiety is a fundamental drive related to our survival. If it didn't exist, it would be difficult for humans to survive. For example, if the fire alarm started going off here right now, we should panic a little and our hearts would start beating faster. We'd breathe more quickly and rapidly. We would need to try to leave this room or the building. This is something that keeps us alive. But if our body starts showing symptoms like a rapid heartbeat or shortness of breath, even when there is no fire alarm going off, that really disrupts our functioning and makes us unhappy. And at that point, we need to seek help. For example, when it comes to exam anxiety, if we have no anxiety about the exam at all, we wouldn't study. Studying may not be something that's very enjoyable for any of us. We actually need to feel some anxiety. It motivates us. But if this anxiety prevents us from sitting down to study, or if it reduces our efficiency when we do sit down, or if we can't perform well enough in the exam because our anxiety increases too much, then at that point we really need to seek help. We need to apply for help.